We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, doctor of physical therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. Today we have with us Megan Glover, who is our public relations manager here at Foundation Physical Therapy. She was actually a patient with our team here at Foundation, and she liked it so much. We twisted her arm a little bit, but she liked it so much that she wanted to play a part in that role. She brings a unique perspective because she's been a patient for years, as a lot of us are, but also she's seen what providers have to go through as well. So we wanted to get her on the podcast today to talk about the patient experience. How do we improve the patient experience? When you hear patient experience, what are you thinking of?
I am thinking of kind of my experience with the providers that I'm working with, kind of how I am listened to and the feelings that I receive and the care that I'm getting in return from the providers I'm working with.
Okay, I love it. Tell me about your experience in the past, about working with providers. Maybe give me a positive story of working with a provider and maybe a not so positive story.
I have been to many different doctors, many different providers to kind of figure out what's going on and some things that I needed to do to get better. I have had 2 hip surgeries, and it took a long time to figure out what was wrong, what was going on. In high school, I was a runner, and I was running as much as I possibly could, and I started experiencing some pretty bad hip pain. And I originally started with my coach and kind of tried to figure out the issue there. And, after some exercises and some different things that weren't helping it, we decided to kind of move on to some physical therapists and then eventually some doctors. It took 4 different doctors to figure out what was going on, and that I had torn my labrum.
So you had a whole team. This was like a comprehensive team you had.
Yeah. So I went to the athletic trainer, I think 2 or 3 different physical therapists, and then 4 surgeons or 4 doctors before the last surgeon was finally able to realize that's what I needed.
What was the hip surgery you ended up getting?
They were repairing the cartilage in my hip socket.
Okay. Tell me about your PT experience through this. It sounds like you went through PT. It didn't get better.
Mm-hmm.
Tell me about that.
Yeah, I remember my first appointment. I kind of went in and I was like, I don't know what's wrong, but I'm in pain. And they said, oh, it's probably just some tendonitis or this or that, but there's a slight chance you might need surgery. They're like, but the odds of that are so small, you don't even have to worry about it. Yeah. So I was like, great, let's do it, whatever we need to do to get better. And after a few months of physical therapy,
Talking months. How many months are we talking?
I think it was 3 to 4 months for my first round before I ended up going to see a doctor.
Oh my goodness. You should not be going to PT that long.
Yeah.
Like if you're not getting better in 12 to 15 visits, like we got to start thinking about a different route. Did you get any improvement within that time?
I didn't experience pain when walking, which was great, but it was...
So you had some improvements.
Yeah,
okay.
But with running, it continued to get worse, the pain with running, and immediately after I'd finished my runs.
Okay. Tell me about maybe a not so positive experience with a doctor.
I feel like there was a few times where I was kind of dismissed with my problems aren't as big as they seem to me. I was initially told it was just tendonitis. If I stopped running, it'd be fine, or whatever it was. And so I said, okay, and I took a break.
They just told you to stop.
Mm-hmm.
Just stop doing everything that you're doing.
Don't do anything. Take some anti-inflammatories.
Let's be clear, that is not how we treat tendonitis nowadays. I mean, that tendonitis, there's a process in which you go through that we unload it, right? But rest is not the answer. Sometimes that's the worst thing that you could do for tendonitis. But so you had this tendonitis, and then what from there?
Yeah, so I took that 2-week break, and then the one run I went on, immediately after that 2-week break, I couldn't walk after I was in so much pain. And so then they sent me on to another doctor who sent me on to another doctor to do cortisone shots and see if that could help. And that helped for about 2 days. And then they sent me on my way to the last doctor I went to before he...
So it actually sounds like you had a pretty comprehensive experience.
Yeah.
And you did all the conservative stuff before, and surgery was appropriate.
Mm-hmm. Yeah. It was very prolonged because they didn't feel, being as young, I was 17 at the time, and they didn't feel like operating was a good idea because the MRI didn't show a tear. It showed just a minor tear, whatever it was, and they didn't think that it was enough to even operate on.
Yeah.
But after...
And you're still growing at that point at 17. So
Yeah.
there's a lot of concerns there that I could see why they would kind of hold back from that.
After that first surgery, they pointed out that the tear was much, much worse than it had looked initially, and that that I probably had been in a lot of pain based off of what they saw.
You told me earlier about a doctor that had made an assumption. Tell me about maybe a provider that maybe assumed something and gave you advice based on an assumption.
That instance that I was telling you about, I had gone to a doctor with some concerns about my heart rate. It was a lot higher than it normally was, and there was just some things going on, and I was concerned. And so I went to this doctor, and within 3 to 4 minutes of that doctor coming in and sitting down with me, he said, "Stop drinking caffeine." And I said, "I don't drink caffeine. I don't drink anything besides water." I can't tell you how
many times I've heard that from patients, just that assumption alone.
Yeah. And he was like, "Okay, well, let's do an EKG, I guess." And after that EKG, he said, "Oh, okay, well, everything looks good. It's just stress," and left. And I was like, I was frustrated because he didn't know what I did for work.
What advice would you give that provider? And this is not a bashing session of providers. There's so many complexities to do what we do. But the perception of the patient, I think, in this scenario is really important.
Yeah.
How did you feel? You felt defeated, you said. You felt, frustrated, dismissed, like all these words that none of us providers ever want you to feel, right?
Yeah.
So what advice would you give us as providers to improve that experience?
Yeah. I really would have appreciated if he had asked me maybe, do you feel like you're stressed, or what are the things going on in your life that could impact my health?
That's
what do
beautiful.
I do for
Ask
work?
Some questions. I love
what
it.
do I do for school? Am I in school? Whatever it may be, I would have appreciated maybe going about that route first instead of just saying, "Oh, it's stress," because I try to do a lot of things in my life to eliminate stress so that I'm not having those things constantly on me where it isn't going to affect my health.
I love that. Any other thoughts on advice you give providers? Tell me a little bit about your PT experience. I know you said, I just felt like I was kind of routine. This is my world. This is something that I want to improve.
Yeah.
So this is advice for a PT.
Yeah. I think something I love about the good experiences at physical therapy I've had is being pushed to reach my limits and to see how far I can go. I would so much rather have an exercise or a PT session where I am sweating at the end. I'm panting. It was hard for me because I feel like that's how I'm going to grow. Instead of just coming in, doing your simple stretches where it's like, okay, just do your routine and then you're good to go. I would so much rather
all the stuff that you could do at home, right?
Yeah, exactly. And I really appreciate the experience I had here where you guys knew my goals. You knew what I was trying to get back to. There was a pain in my life that was limiting me, and I wanted it gone for a reason.
What was that goal? What were you working towards?
I wanted to get back to running. I love running, and I really...
How did your plan, how did it focus on that goal?
I feel like there was a lot of strengthening that was involved, but then there was also, I'd hop on the treadmill every session and, we'd see how I was feeling. And
Would you spend 30 minutes on a treadmill?
No. I'd do my warm up on there and I could say how I was feeling or if I was feeling pain in this area or whatever it was. I feel like it was aimed at those things, but not just, the general, oh, here's your running exercises, but maybe you're having this problem with your running because this muscle is weak or because of this problem.
So it was the tie between here is the mobility deficit, or here's where you're tight, or here's where you need to strengthen, here's the muscle imbalance, but this is why it hurts when you do this when you run.
Yeah.
So you kind of made that connection.
Yeah.
So you're saying maybe educating on why.
Yeah.
Why you're doing those things really helps.
Yeah. And there's another instance where I was getting really bad headaches when I ran. And that was really frustrating for me because I felt like I had to stop. What was really beneficial is I was educated on how to really lean into those symptoms or use them to know how to guide my running. And I was able to start creating programs where I was able to start running further and harder without receiving those headaches because I was taught how to listen to my body and what things I need to be doing in order to go on those runs that I want to.
So you kind of set parameters on saying this is how hard to push your body, this is what to look for, and then make constant adjustments based on how you responded.
Yeah, exactly. I feel like constantly I was told, listen to your body. That's all you need to do is listen to your body.
What does that
be
mean?
Dumb. And I never knew that. I really was like, okay, does that mean stop running instantly when I feel pain? Or
when was that connection made when you said, That made sense now. What kind of created that connection?
I think one of the biggest things was when I was in one of my PT appointments and I was on the treadmill. It was before I was explaining my frustrations with like these problems I was realizing, and my physical therapist took me and he put me on the treadmill and said, "Okay, we're gonna practice this. We're gonna see." And the entire time we were talking about where my symptoms were, what levels I felt I was at, and then he's like, "Okay, do you understand? This is when you're gonna stop. You're gonna go until you walk until you feel this, and then you can start running again." And it was really putting that into practice that I was able to understand. Okay, this is what it means to listen to my body. This is what I need to do, and then I was able to implement that at the gym or out on my runs.
A lot of the challenge that we face in the clinic is, when patients late or 10 minutes late to their appointment, and we're seeing patients every half hour, we only have so much time with patients, right? And sometimes I think we get in the habit of, okay, I'm going to try to get as much done as possible in this time period, but we forget to really connect and ask questions.
Yeah.
Like, what do you understand about listening to your body? What does that look like for you?
Yeah.
How do you actually listen? What does it tell you? How does it teach you, right? And I think sometimes we miss that gap because of time, right? It's just super crucial that patients are on time to their appointments because it allows us to spend more time with them.
Yeah.
Because in order to be fully present with you, I have to be fully present with my next patient. If you're 10 minutes late, it's going to either cut into their session or it's going to cut yours short. So it's super helpful for us when we're on track. Tell me about the work environment or the in healthcare. I've been in hospitals where all the walls are white, no windows. This feels very cold.
Yeah.
I'm greeted and it's like, hey, fill out your paperwork and sit down. Not greeted by name, things like that. Tell us about what makes the patient experience great.
Yeah. I think instances like those are just kind of draining, where there's not any energy in the clinic, or you're just kind of moved from one place to the next. It's not ideal. And I feel like I never wanted to work out in those instances. It was never really inspiring to me. With Foundation, I love that, all the clinics just have wide open windows and you can see outside and you can feel inspired.
Kind of get natural light.
Yeah. Yeah, it's so much happier. It's just, you feel like you can actually do things and work and move around. And I think that's a big part of having the motivation to do what you need to do, because obviously sometimes rehab is really hard. But, when you feel motivated by the environment and the people that are around you, it makes it so much easier.
Yeah. Outside of PT, just thinking healthcare in general, what do you think we can do as a healthcare system to improve the patient experience, whether it's being greeted differently at the front desk, having more inspiring environments? Tell me your kind of top things to improve.
I really think just genuine connection is so big between the provider or the patient or, the medical assistants, the front office, whoever it is. It's if you just feel like it's very routine, you're just kind of talking to a robot, basically, you're not going to want to share or open up.
Yeah.
And I think that's a large part of healthcare is being able to open up and discuss things in depth. And so I think just genuine connections between the people is what makes things so much better and really just gives me the desire to get better.
Yeah. I have my primary care doc, his name's Brandon Hansen. He is phenomenal. And the system he is challenging system. He sees 30, 40 patients a day. But the reason I chose him as a provider and for my family is because when he walks into the room, nothing else matters. He genuinely connects with you. And he makes that deep connection. And regardless of the hundreds of other things he has to manage, you're the only thing that matters in that moment.
Yeah.
And that's why I picked him as a primary care provider, because I knew he was going to listen to me. I knew he cared about me. I knew he cared about my success and cared to hear my story too.
Yeah. And you can definitely tell the difference as a patient, right? Whether they're trying to get to their next appointment or no, they have five patients waiting, right?
And,
yeah.
Antsy.
Yeah. You can feel the difference when you're in that situation, whether or not that provider wants to be there with you.
One thing that I found really helpful on the patient side that I think we can improve is sometimes people will come in with a list of 25 things. And I get it because they've been dealing with it all, right? Something that's really helpful for me that I'll say to a patient when they have a huge long list, I'll say, what do you feel like is the biggest priority first? We're going to get back to, I promise you all of this. We'll have conversations about that and I'll help you solve those problems as we go. But what is the most important to you today?
Yeah.
Right? And then I am in control of the situation. I'm not controlling. That's important. But I'm in control.
Yeah.
right? And I guide patients and not cut them off, right? Allow them to speak, but also let them know we have a certain period of time and we're going to cover as much as we possibly can in this time. And then let's work on it and let's come back together.
Yeah,
you know?
absolutely. And I think that is important. It's not just the provider's job to fix things or to do that. It's a two-way street. And, it requires work on both ends. And we, respect is deserved both ways to be able to, provide and receive the best care.
Yeah, absolutely. Last two things I want to cover is first, I want to cover just what does a red carpet experience look like? I mean, Disneyland experience. How does that look like in healthcare? And then the last one would be education. So let's cover and specifically education on how have providers educated you that's been really effective and maybe what's not effective.
Yeah. One thing education-wise that I really appreciate is understanding why. Like, I don't want to just be told to go do this or go do that. I want to know why I'm doing it.
Or not do this, not do that.
Yeah, exactly. I think it's so much more beneficial because then I feel like it's a principle that can guide me instead of just one decision. Like, oh, I can't do this, but maybe there's a reason behind that. And that reason could be affecting other things, right? And so if I understand the reason, I can stay clear of, oh, I shouldn't do these things instead of, oh, I can't do this one exercise or whatever it is. And I just like if with education, once I understand the principles, I can make better decisions instead of the decision already being made for me. I feel like I'm in control. And that's ultimately what I want is I want to be in control of my own body.
I remember when I was 17 years old, I had a broken thumb. I had some pins that were sticking out of my thumb, and I was in a championship, and I had I think one more race, and I broke my thumb, and I my doctor told me you absolutely do not ride motorcycles. And in my mind I was thinking, I'm gonna do it.
Yeah.
And why can't you just teach me how to do it safely?
Yeah.
Because I was already gonna do it. I was in a championship. I'm not saying providers say it's okay to do it by all means, but if you're already going to make the active choice to do it, why don't I teach you how to do it safely and protect your hand and teach you the consequences if you do it, rather than saying just don't do it. I want to teach you why you're not going to do that, right? Because I still raced and I still took the championship, but that was the purpose of racing. I was going to do it slow, but I would have appreciated the concept of, do you need to race or do you feel like you have to race, right? And teach me some components and consequences, good and bad, if I choose to do it.
Yeah, absolutely. And my hope coming out of an experience like that with a provider would be to give me education that I can use in the future. Yeah. Not just in this specific instance, but, say 5 years from now I get another injury. I can say, oh, I don't need to instantly go to the doctor. I can try these things that I learned from before and apply those things. And I feel like really take control of my own health before just throwing it at somebody else.
Yeah, absolutely. Okay, last topic is the patient experience. Here at Foundation, we pay attention to lighting, Kelvin of lighting, smell, color on the paint on the walls, natural light coming in through, the morale or collective energy of the space, right? What do you feel like are things in the healthcare world that we can improve in that patient experience?
Yeah, I think just making it an environment you'd want to be in. I have been into many doctor's offices just due to previous jobs and this job now. And sometimes it's just depressing. You walk in, you're like, man, no one wants to be here. It sucks all the energy out of you. Not even the employees want to be here. You can tell they're just trying to make it to 5 o'clock so they can go home. Yeah. And I think if it's those little things you said, right? The lighting, the smell, all of those things that combine to make it one large thing, right? I don't think everybody's going to walk in and notice instantly, oh, I like this about that or whatever it is, but it's those little choices we make and those things that we can do that create to the overall culture. And, I think if we can just make small changes here and there to make it more pleasing, to make it somewhere where everyone wants to be, not just you have to go for your appointment, but, the employees want to come to work every day. They enjoy seeing their coworkers, whatever it is, those little things that make the bigger environment is what are super important.
Absolutely. I love these ideas. I love these components that we've talked about today. Megan, thank you for joining us on this podcast to improve the patient experience. That's what it's all about. That's what healthcare's for, is to improve the patient experience. If you have stories like this, we'd love to talk to you because we want to improve healthcare and revolutionize it today and start today. There's no reason to start tomorrow. Let's start today improving our system. And it takes the whole team, the patient, the public relations manager, the provider, all of the attacks, like everyone working together to improve the patient experience. Thanks again for joining us today. We appreciate you, Megan.
Absolutely. Thanks, Brad.